Do you feel a deep, throbbing ache right in the crease of your groin when you try to walk or climb stairs? Does the outside of your hip burn when you lie on your side at night? Perhaps your local doctor took a quick x-ray of your pelvis, saw some age-related wear and tear, and immediately diagnosed you with coxarthrosis, scheduling you for a total hip replacement. Or even worse, did you already undergo a massive hip replacement surgery, endure months of agonizing rehab, only to realize the exact same burning pain is still shooting down your leg? If you checked these boxes, you must stop everything. You're standing in the middle of a massive medical misdiagnosis. Your hip joint might be perfectly fine. You are likely suffering from fake hip pain. Your pain is real, but the source is entirely different. It could be a crushed nerve high up in your lumbar spine, a surgical complication, or, surprisingly, a simple muscular failure. To understand why your hip hurts when the problem is somewhere else, you must understand the electrical wiring of the human body. Think of your spinal cord as the main electrical breaker box in your house and your hip joint as a heavy-duty appliance plugged into the wall. The electrical cables that power and give sensation to the front of your thigh and your groin originate very high up in your lower back, specifically at the L1, L2, and L3 spinal levels. If a spinal disc herniates at the L2 level, it clamps down on that specific electrical wire. The brain receives a massive distress signal from that wire. Because that wire ends in the hip and groin, the brain assumes the hip is being destroyed. The pain is very real, but it is referred pain. The appliance is perfectly fine. The short circuit is happening inside the breaker box. You cannot cure a pinched spinal nerve by replacing a hip joint. But what if the problem isn't in your spine or your hip joint? This brings us to the most common scenario we see in our clinic. A patient comes in terrified. They have severe pain on the side of their hip and buttocks. They are convinced they have severe sciatica and need emergency spine surgery. But when we perform a physical examination, their hip joint has a perfect range of motion. Their spine is stable. The hidden danger is a muscular failure. The powerful muscles around the hip, specifically the gluteus medius or the piriformis, have become incredibly weak and tight from years of sitting or poor mechanics. When these muscles fail, they spasm and become severely inflamed. This inflammation pulls on the tendons attached to the hip bone, creating a burning, agonizing pain that perfectly mimics a dying hip joint or a pinched spinal nerve. If a surgeon operates on your spine or your hip joint when the true problem is a weak gluteal muscle, you are undergoing a catastrophic, unnecessary trauma. This anatomical overlap leads to a terrifying reality for patients who have already had surgery. We receive phone calls every week from patients in tears. They had a total hip replacement, but their leg is still on fire, or their foot is suddenly numb and dragging. This happens for two reasons. First, the original diagnosis was wrong and the spine was the culprit all along. Second, the hip surgery itself caused new nerve damage. During a hip replacement, the surgeon must aggressively stretch and retract the massive muscles and nerves of the pelvis to insert the titanium implant. This extreme stretching can physically crush or stretch the sciatic nerve or the femoral nerve, leading to severe post-surgical neuropathy. This creates the ultimate diagnostic nightmare. If a patient with a new titanium hip needs to check their lumbar spine for a pinched nerve, they hit a brick wall. The local hospital tells them, "You have metal in your body. You cannot go inside an MRI machine." The patient feels completely abandoned. But you are not out of options. While a high-definition MRI is always the gold standard for viewing soft nerve tissue, we must act as medical detectives when MRI is prohibited. We immediately pivot to a high-resolution computed tomography or CT scan of the lumbar spine and pelvis. While a CT scan is primarily designed to see bone, modern multi-slice CT scanners can provide excellent detail of the spinal canal, allowing us to see if a calcified disc or a massive bone spur is choking the nerve root. We can also use advanced nerve conduction studies, EMG, to map the electrical current running down the leg, pinpointing exactly where the nerve is damaged, whether it is up in the spine or down near the new titanium hip. Because the symptoms of hip arthritis, spinal compression, and muscle failure are nearly identical, the treatment pathway must be perfectly targeted. We use a strict protocol to isolate the pain. Before we ever suggest spine surgery, we perform a highly precise X-ray-guided diagnostic nerve block. We inject a microscopic drop of numbing medication directly onto the L2 or L3 spinal nerve root in your back. If you stand up and your hip pain instantly vanishes, we have undeniably proven the short circuit is in the spine. Once we prove the spine is the culprit, we fix the spine. We use advanced, minimally invasive techniques. If the compression is a soft disc herniation, we utilize percutaneous laser disc decompression to vaporize the pressure inside the disc. If hard bone spurs are choking the tunnel, we use endoscopic spine surgery. Through a tiny incision no wider than a pen, we use a high-definition camera to gently shave away the overgrown bone, physically freeing the electrical cable. The recovery is rapid. The false signals stop, and the burning pain in your groin and hip permanently disappears. If you have been told you need a hip replacement, but your lower back also constantly aches, you must hit the pause button. If you already had a hip replacement but your leg is still on fire, do not lose hope. Stop guessing and stop treating the wrong anatomy. Let our expert neurosurgeons review your complete medical history and imaging. Click the link in the description to upload your lumbar CT or MRI scans to our secure portal. We will trace the electrical wiring from your spine to your hip, give you a definitive second opinion, and ensure you are targeting the true source of your pain.